We are still seeing very high case counts from the coronavirus, and we're seeing increases in the number of people who are hospitalized with this infection. But there are some signs of a decrease in the number of new cases, which we can only hope will continue. So people still need to stay away from others in order to lower risk during this very tough period. For the numbers, since this time yesterday, we've identified 601 new cases of the coronavirus infection in Philadelphia residents by the PCR test, bringing us to a total of 67,025 confirmed cases since the beginning of the epidemic. Now, in addition to that, we have 59 new probable cases diagnosed by the rapid antigen test since this time yesterday. Now, for the past week that ended on November 28th, we averaged 606 cases per day. That's confirmed. And so far, though, that's a decrease fairly substantially from the 894 cases per day the week before. Now, those numbers for last week are likely to increase because there's delayed reporting we always get from laboratories. Of those people who were tested last week, 9.5% were tested positive. That's lower than the percent testing positive the week before that, and when it was 10.6%, and lower than 2 weeks before that, when it was 11.7%. So overall, whether you're looking at cases or looking at percent positive, we are seeing a declining trend in the past couple of weeks. That's clearly better news. It's a change from the very rapid increases we saw before that. But I do have to put in a couple of cautions here. First, there are many fewer tests that were done last week because of the holiday, so that's going to influence the number of positives we'll get. And it's still too early to say if there was increased spread as a result of the Thanksgiving holiday. When people get together over a meal and they're not wearing masks, we know that's a risky situation. I hope that we'll know by this weekend whether we're seeing an increase as a result of the Thanksgiving holiday. And regardless, even with the decreases, the number of daily cases we're seeing now is still extremely high. That's what's happening in the community as a whole. What about in nursing homes? We're continuing to see cases and clusters in these most vulnerable facilities. The week of November 15th, there were a total of 118 cases in nursing home residents. And last week, there were 61 cases we've identified so far. That's a big increase from the 10 to 15 cases per week we were seeing in August and in September. Now, a lot of people in nursing homes and people supporting them are working very hard to try to contain the spread within nursing homes. Among the things we're doing is for nursing home residents who are positive, if they can't be safely managed in the nursing home to protect the other residents, they're transferred to our city's COVID relief unit. City's COVID relief unit now has 47 of these residents. What about the acute care hospitals? Well, with the very high daily case counts, we have more patients being admitted to the hospitals with COVID that are being discharged with COVID every day. That means the number of patients who are staying in the hospital continues to increase. That's true in the state of Pennsylvania as a whole, and that's true in Philadelphia. The state's database on hospitals says that as of yesterday, there were more than 4,600 COVID patients, inpatients there, staying at the hospital. Now, just a week ago, that was 3,400. And to put that in context, last spring, the highest number they had was around 2,800. So it's way beyond where they were last spring as far as the number of hospitalized inpatients. We don't quite know how many they can manage statewide. Now, here in Philadelphia, this morning, there were 820 patients hospitalized with COVID. That's up from 672 patients a week ago. Both of those numbers are below the 1,000 patients that we had in the peak in the spring. Our hospitals can handle that now. We know that they could handle 1,000 in the spring, but it wasn't necessarily easy. I'm still concerned that the hospitals may come under strain just in the next 2 to 3 weeks. What about deaths? Since this time yesterday, we've identified 9 new deaths, bringing us to a total of 1,985 deaths from COVID since the beginning of the epidemic. Now, for the week of November 15th, by the date of death, there were 23 deaths. For the week that started November 22nd, there were 18 deaths so far. Now, both of those are higher than the 10 per week that we saw when we were at the low point in September, but they're less than what we projected we might be having at this point. So it's possible that the steps we're taking are limiting the number of deaths somewhat. Let's hope so. And just remind everyone that the safer at home restrictions we put in place went into effect 11 days ago on November 20th, is scheduled to continue through January 1st. They include no indoor gatherings, no indoor dining, no indoor sports, gyms, museums, or libraries. As far as retail stores, they're allowed to be open, but people are required to wear masks, and stores are responsible for enforcing that. In addition to that, there's a limit to the number of people who can be in stores at any one time. It's 5 per 1,000 square feet. I hope that if you have gone to a retail store, you've seen in the past few days that they're limiting the number of people inside so they don't get over that limit. We're having teams that are going to stores both in Center City and now in other parts of the city to remind them and educate them about these requirements. If you want to know any more about the guidance for these current restrictions, it's all on our website, www.phila.gov/safer-at-home. Now, just a couple of words about vaccination. We now have 2 vaccines that have been shown, at least by the company's reports, as being 95% effective at preventing COVID. That is excellent news. The second of those vaccines is now under review by the FDA. The Moderna company submitted their application to the FDA yesterday. The first vaccine that went to the FDA for a review was the Pfizer vaccine. They're both under review right now. I'm hopeful that they will both be approved by the FDA. And if they are, it's likely that we'll start vaccinating in mid-December, just 2 to 3 weeks from now. Now, initially, we know we're going to get a limited number of doses. We don't know how many it'll be, but we know it'll be limited. And our first priority group is going to be healthcare workers who are routinely exposed to COVID, both to protect them from infection and also prevent them from spreading the infection to the patients that they're seeing. As more vaccine doses become available to us in the coming weeks and months, we'll gradually increase the groups that are able to be eligible for vaccination. In the meantime, what should people do? Remind people this is still a period of very high rates of infection, the highest rates of the entire epidemic so far. People are safer at home. So work from home, if at all possible. Stay home away from others unless it's necessary. When you do have to be around anybody outside of your household, make sure you wear a mask. Now, for those people last week, if you did happen to get together indoors without masks with people outside of your household, you are at some risk. We're recommending that you stay away from people for 14 days because you may have acquired the infection then, you may be incubating it now, and you may turn positive in the coming days. Overall, I would say we're still in a difficult period in this epidemic. This is a tough period. It's maybe among the darkest days of the epidemic. However, I think it's going to get better from here. I'm very optimistic about 2021. We just need to get there safely. So if we can act responsibly now, we can save many lives between now and when we really have adequate amounts of vaccine. More information on all of this is on our website, www.phila.gov/COVID. Thanks.
Thank you. 2 for Dr. Farley and then 1 for the mayor. Dr. Farley, you just said that the darkest days are ahead of us in terms of the pandemic, but have also reported 1,985 deaths. When we're through the darkest days, how many Philadelphians will have been claimed by this virus?
Well, it's impossible to predict. Let me say that other people who are trying to predict this epidemic with mathematical models are suggesting that this wave could have as many deaths as the first wave. Now, if it did, that would double it, and we would be at maybe 3,600 deaths by the time we finish this wave. I'm hopeful, though, that what we're putting in place now, these restrictions are going to blunt this next epidemic wave, and the protections we're putting in place for vulnerable people will blunt the deaths from those. So the numbers I showed you yesterday was a little bit better than what I reported a week ago. So I have hope that it won't be so bad, but it certainly could be.
There seems to be an unwillingness and a concern among some members of the public about taking these new vaccines. In part, they'll say, well, the FDA is working so quickly and the vaccines were developed so quickly. Do you think there is a significant enough percentage among Americans who will be unwilling to take the virus and undercut its effectiveness across the population?
I'm going to say right now it's reasonable for people to have questions about that because these vaccines haven't been reviewed yet by the FDA and nobody has seen the studies. It's only been results reported by press release. So that's a reasonable perspective right now. I hope that when we get the results out there and scientists can look at those and verify that this is safe, that enough people will take this vaccine that will be able to really have a big dent in the epidemic spread by the number of people vaccinated. It won't be 100%, but it doesn't need to be 100% for us to really have a big impact on the epidemic.
Thank you. Mayor, just one for you. You've been asked a lot about violence on these Zoom calls, Mayor. Once again, we've seen tremendous bloodshed, unfortunately, over the holiday, many of them among teenagers. Mayor, do you now believe that the city's response to violence is simply not working? Are you willing to say that now? And
First of all, Jeff, as usual, this is not a COVID question, but I'll answer anyway. You seem to want to jump the line all the time, but that's okay.
I'm sorry, Mayor.
And we had a period of time in our city where police resources were diverted to civil unrest, and we're not doing the things that we want them to do to stem the tide of violence and crime. We got behind because of basically weeks of that, and we're trying to recoup and and reorganize and get back to the issue of policing. But I will tell you right now, until and unless the United States and the state of Pennsylvania decide that they're going to limit the number of guns available to people in such a quick fashion, we're going to continue to have this violence. We take about 400 plus guns a month off the streets of Philadelphia, and I will bet you they are simultaneously replaced one for one within hours. So we're going to continue to do what we have to do out there in the street to put our people in place, to approach violence as a group violence issue, and try to get between some of these young folks and their social media arguments and the like. But as long as there's availability of guns, as long as someone can get an AK-47 as fast they can get it faster than get a driver's license, we're going to continue to struggle with this around the country.
Thanks.
Thank you, Jeff. We're going to go now to Annie McCormick at 6ABC. Annie, you can go ahead and unmute yourself.
There you go. Sorry. I have 3 questions. The first one is for, I believe, one of the finance directors. It's in regards to the announcement that you just made to the help to restaurants. Obviously, since we just heard it, I haven't been able to touch base with restaurants yet to see how that will impact them. But I just want to give you an analogy and ask your opinion about how much you think that this will help, say, an individual restaurant owner. A couple of weeks ago, the state had decided to waive a number of license renewal or a license renewal fee for restaurants, and had kind of made it seem like it was going to have a huge impact for the individual owner. But individual owners had told us it was only about $500 or $1,000 that it would yearly that it would help them, which is something that they can make in revenue in just being open one night past 11 p.m. And again, like I said, I haven't been able to check the restaurants, but how much of an impact do you think that the help that you're announcing today will have on the individual restaurant or bar owner?
I think it will help them in that it will reduce one of their expenses, particularly at a time when there are parts of their facilities they can't use. It seems like an appropriate step to take and something that will give them assistance that we can provide.
Do you have a number, though, like an average number that you think it would, in regards to money, how much it would save the individual restaurant or bar owner?
Yeah, we have a kind of a preliminary estimate from the school district who the tax goes to of the total amount, which is about $10 million. That number may move around a little, but so we think it's about a $10 million impact.
And I don't want to use this as my third question, but because I do have another one for Dr. Farley, but can you just give us a little bit of a better idea? When you say 10 million, is that divvied up among all the restaurant bar owners in Philadelphia?
Yes, all the ones that pay the UNO, and I don't have a number of how many counts that is.
Okay, and one quick question for Dr. Farley. We're also seeing that the number of complaints to 311 have actually risen over the past month by 38%. Wondering if you are surprised to see how many people are reporting in regards to social distancing complaints. Are you surprised to see an increase of that nature? And compared to back when you initially had the restrictions, it doesn't appear that you saw this amount of complaints.
I don't know whether I'm surprised or not. It's hard to predict what people are going to call about. I would probably predict that as a good thing. This means that people have taken this epidemic wave seriously, and they're seeing something that worries them, and so they're trying to bring that to our attention. That's going to happen. We need people to talk to each other, to self-enforce these restrictions, to try to protect each other.
Thank you.
Thank you, Annie. Next up, we have Lauren Make at NBC 10. Lauren, you can go ahead and unmute yourself.
Thank you. Good afternoon, everyone. I have a couple questions about vaccines for Dr. Farley. Dr. Farley, you had previously said that you would be making a determination on before distributing a vaccine, that you wouldn't just be taking whatever was given to the city, that you would be making your own determination. So given sort of how close we are right now, what is that process? Do you have a team working on that? Are you going to make the determination yourself? What will be the process after the FDA gives its approval for you to determine if you feel comfortable distributing that vaccine?
Yes, so we'll see what the FDA says. We'll also see what and I hope we get details beyond just approved or disapproved. We'll also see but the publications show. Well, I hope that these companies are going to be publishing the results of their phase 3 trials. And there also are expert groups that have been convened by other states around the country that are going to look at this and do an independent review. And so we're going to be looking at what they review as well. We decided it would not make sense for us to convene our own expert panel here in Philadelphia. We think that there's enough other experts around the country reviewing this that we can take their advice. But we're going to be looking at all of those.
Okay. And you mentioned that the first people to get it would be the healthcare workers who are coming into direct contact with COVID patients. How will you identify which healthcare workers those are? Are you relying on the hospitals to basically give you lists? Will you go into the hospitals? How is that going to work?
Well, some of it's going to be going to hospitals. Some will go to other healthcare providers, other organizations that provide healthcare. But the hospitals will be given some number of doses of vaccine, which is an estimate of their proportional amount, and then so to be roughly how many of their healthcare workers we think might be in that category. And then it's going to be up to the hospitals to determine which ones meet that category. We don't know the work patterns of each hospital staff person well enough to say whether this person should be vaccinated and that one shouldn't. But I can tell you the hospitals will get vaccine that is less than the total number of healthcare workers they have. And so they're going to have to make the decision about who are the highest risk among them.
Given that the vaccines that we're talking about are different in terms of how they need to be stored, in terms of whether it's 1 dose or 2 dose, will you get to decide, or will the city get to decide which vaccine you want, which one you think fits the population here?
We'll take whatever vaccines the federal government has approved and we think are safe. And right now, the first 2 vaccines are both 2-dose vaccines. Well, what I'm hearing, I don't think we're going to have another vaccine approved for at least a couple of months and maybe for 4 months after this. So we're going to be with these 2 vaccines for a period of time. If it is March or April when another one becomes approved, we'll be happy to add that to the vaccines that are available in the city.
Thank you.
Thanks, Lauren. Next up, we have Natasha Brown at CBS 3. If you want to go ahead and unmute yourself, Natasha.
Hi, thank you very much. This is for Dr. Farley, this question. Dr. Farley, just during the Thanksgiving holiday, or just ahead of the Thanksgiving holiday, we saw a lot of people just trying to figure out how to get tested. Many people saying they were trying to get appointments at different places, lots of urgent cares, things like that, they were backed up for weeks, or at least a couple of weeks or so. What are your thoughts just about testing sites around the city? Are they reaching a level of, strain at this point because more and more people are being tested or being asked to be tested if you do plan to travel or possibly be around family during this holiday season?
Yeah, there was a big surge in demand for testing right before the Thanksgiving holiday. We have times there where we were doing 10,000 tests per day. Before that, we were doing 5,000 or 6,000 tests per day. So it was a big increase in demand. And because of that big increased demand, there was difficulty for some of these people to be tested. Now, a lot of these people were simply being tested before they were going to travel. They weren't our highest priority group. Highest priority people would be those who have symptoms or those who have been exposed to COVID. We still think we can handle those people if we don't have that sudden surge. It's kind of like on a normal year, what's it like at the airport on the Wednesday before Thanksgiving? It's crowded. That's what it was like here for that testing. I'm hoping we don't have another period like that for the upcoming holidays, because not everybody will be traveling all at one time.
Okay. And what about also the lab result turnaround time? We know that a lot of times there was a lag with that as well. Many people saying that it took 4 or 5 days even to get their results back. Are you expecting anything like that as well? Or is there any way to expedite that at this point in light of the holiday Christmas season coming up and Hanukkah and other holiday seasons coming up?
Yeah, many labs did turn around the results in a day or two, but with that increased demand, the labs did get backed up. And so there was a slow turnaround for a couple of labs in particular, a couple of big labs. That's too long. We are trying to see what we can do to get the labs to report more quickly. A lot of it's out of our control. So we're going to probably have some delays if there's a period of high demand like that.
Okay. And one last thing.
We are also, though, little by little deploying these rapid tests, which give a result that is not quite as reliable, but it gives the results much more quickly.
Okay. And do you have the same advice overall, Dr. Farley, with the next holiday season coming up, Christmas and things like that? What's your advice there as well? Is it the same as what you were telling people about Thanksgiving, or what are your thoughts just with this next holiday?
Yes, unfortunately, it is the same advice, and that is you should be celebrating with members of your immediate household only, not by getting together with people in other households. We're still going to be at very high rates of disease, even if we're successful in lowering it between now and then. And if you're mixing households, you're going to be adding risk.
Okay, thank you very much. Appreciate it.
Thanks, Natasha. Next up, we have Jack Tomsic at Metro. You can go ahead and unmute, Jack.
Hello, thank you. First question is for Dr. Farley. You mentioned the healthcare workers getting the vaccine first, and I guess it, hopefully will be this month. Who will get it after that? What will be the priority list there?
We'll see. I should say that there's a committee on the Centers for Disease Control called the Advisory Committee on Immunization Practices. It's meeting today to further refine recommendations about priority groups, and we're going to be very interested in what they have to say. We'll generally follow what they have to say. I can say other categories of people who would be higher priority than just your average person would be what's called critical infrastructure workers. Those are people who have to work, can't work from home, and are exposed to a lot of people doing work. That could be, police and fire, that could be SEPTA workers, those sorts of folks. Then would be people who are more likely to have severe infection, such as people who have underlying medical conditions or people over the age of 65. When we get through all those folks, then we'll be vaccinating just your average person.
Okay, thank you. And one other question for you, Dr. Farley. Do you have any data on whether any businesses have been shut down or cited as a result of the safer at home restrictions?
I don't have data. I do know that there have been some businesses that have been shut down. I don't have numbers for you. We can try to get you something and follow up.
Okay, thank you. And then this question's for Rob Dubow. With the UNO tax, you said that would cost the city $10 million. Do you have an overall impact of all of these announcements today, the impact on the budget?
Yeah, so the UNO, it's a preliminary estimate, so that might move a little, but that's around 10 million. The other two are probably more timing issues, so probably won't have an overall net impact on our finances. They'll just kind of change when we get revenue.
Okay, thank you.
Sure.
Thank you, Jack. Next up, we're going to have Hannah Chin at WHYY, followed by Sean Walsh at the Inquirer. It does look like those are the last two for the COVID round. So if folks have other questions on topics that are not COVID related, you can feel free to raise your hand now, and we'll have time for that at the end. So Hannah, you can go ahead and unmute to ask your questions.
All right, great. This question is for Dr. Farley. I'm just wondering, I know prior to the safer at home restrictions and even now in the holiday seasons, you've directed a lot of messaging towards individuals, kind of asking them to avoid hosting large gatherings at home, et cetera, since they could be high risk transmission settings. I'm wondering, because epidemiologists have expressed the desire for kind of more comprehensive data about those transmission settings and where transmission is happening the most, do you have that data and are you planning to release it anytime soon?
We are not, doing studies about where it's actually being spread in the city. We get information through the process of contact tracing that gives us some sense of where it's being spread. But to really figure out where it's spread is difficult, and it's not studies that are easy to do. I can tell you of the people who are, we interview for contact tracing, more than half of them don't know where they got the infection. Of the people who know where they got it, it's things like household members and small social gatherings. And then there are other things like offices and workplaces where it shows up. And if you're interested, we can get you some general numbers on that from contact tracing, but it's not the kind of, detailed answers that people want to know because those are hard to get at.
So if we don't have that detailed answers, why direct so much messaging towards individual gatherings kind of outside other businesses or restaurants, et cetera?
I'm not sure I understand the question. Why is it tell people not to do gatherings?
Yeah, well, I guess I'm wondering why direct so much attention or messaging around the individual gatherings? Obviously, those are transmission settings, but why target those if we don't necessarily have a bunch of data pointing to those as the highest transmission factor?
Well, we certainly, it's a very frequent exposure that is identified amongst people who have infection, and they say that they know where they got it from. So if they say, yeah, I know where I got it from, we ask, well, who did you get it from? Most common answer is a household member. And then after that, you get to a social gathering, like someone visiting from another household, or a group of friends getting together. So it is very frequent. And we got to believe that even though we don't have hard statistics, it means it's an overall pretty high proportion of the infections occurring in those settings.
Okay. And then one last question. Can I ask what percentage of those people are responding to contact tracing? Basically, are we talking about 14% of the population who you can reach via contact tracing said this, or are we talking about 50%, more than 50%?
No, we can get you that number. I don't have it on the top of my head, but we can get you that number.
That'd be great. Thank you.
Thank you, Hannah. Next up, we have Sean Walsh at the Inquirer. Sean, if you want to go ahead and unmute yourself.
Thanks very much. This question is for Dr. Farley. Can you talk about the potential of the city requiring vaccines be administered in certain cases, for instance, requiring hospitals to have the healthcare workers do that, or if schools reopen, having the kids be vaccinated before they're allowed to come back to school? Is that something that's on the table?
Right now we still haven't heard about the vaccines being approved and safe, and I think it's early to talk about mandating vaccines. And certainly for your average person, I don't think we'll ever get there. We'll be requiring that. It's possible in some settings that we would require or where the organization would require it. For example, nursing homes, which are sort of ground zero for this epidemic, it might make sense for staff there to be required to be vaccinated. Broader than that, we certainly haven't discussed that. I think it might be less likely.
Okay, thanks. That's my only question.
Thanks, Sean. Next up, we have Pat Loeb at KYW. You want to go ahead and unmute, Pat? Let me see. Pat, I'll try to unmute you just because it seems like there might be something stuck. There you go.
Okay, thanks. My questions are also about gun violence. The first is a two-part question for the mayor. You keep saying that you need help from the federal and state governments to control guns, but that very clearly is not going to happen. So are you basically throwing in the towel and saying there's nothing the city can do as long as there are a lot of guns out there to reduce the number of shootings?
No, I'm saying we're going to continue to work hard to get 400 guns a month off the street at least, and also try to work hard to do the group violence initiative so that we can interface with these young men, generally young men, who are shooting each other or being killed, and try to figure out how to divert them into other areas of interest like education, social service support, jobs, and dealing with their families to continue to urge their families to intercede with them, trying to put our police in strategic places where we think things may happen in a particular section of the city, and continuing to try to improve the economy, even in this COVID devastated economy, to get it back so there are more jobs available for people to go to work as opposed to standing on a corner with a gun in their belt. So we're not throwing in the towel by any means, but I'm giving you the realistic situation that in America, guns are just everywhere. And as long as guns are everywhere, we're going to continue to struggle with this. So it's not throwing in the towel by any stretch. We're working hard on many levels, the police and all social service agencies, community college, every drug treatment, you name it, we're doing it. And we're not getting a lot of help. We're not getting any help from the federal or state government in all these efforts. So we're kind of out there on our own. And sometimes that's frustrating. And I'm sorry if I sound that way.
It's true that guns are everywhere, but not every city is seeing the kind of surge. And
no, Chicago is seeing it. New York is seeing it. Baltimore's seeing it. So I don't know where you're getting your numbers, but they're all seeing it.
I think Tumar might have had something he wanted to jump in with. Tumar, if you wanted to say anything.
No, Lauren, I think the mayor covered it. I think he covered it correctly.
And well, given that the city has set a record this year already, and it's not even the 31st, for the number of shootings, a record. Is the Office of Violence Prevention Plan working?
Well, the record has to do with the fact that for a number of months, we redeployed police because of civil unrest. So they could not patrol their areas of the districts that they normally patrol. That left those places uncovered and more susceptible to violence because of the lack of their presence. And that's how we got behind. And that's how we saw the number that we're seeing now. We expect that number to go down next year if we can continue to get rid of COVID and get our economy back in shape and put our police back in the areas where they need to be in order to fight crime.
Okay, thank you.
Thanks, Pat. Next up, we have Martin Pratt from Philly Your Black News. Martin, you can go ahead and unmute.
Thank you.
Martin, it looks like you're still muted.
I'm sorry.
There you go.
Sorry. One question for Dr. Farley and then one question for the mayor and Tumar. Dr. Farley, have we seen the numbers, and I don't want you to get specific, but have we seen the numbers increase specifically in city workers? Like we saw the numbers the last surge of numbers of people who are affected by COVID were in 2 specific city departments. Are we seeing that happen again? And if not, what do you think are some of the reasons why we're not seeing a surge?
Yeah, in the health department, we get our laboratory results from laboratories, and which doesn't have the occupation of the person, doesn't have the employer. So we can't count how many are city workers. I can tell you just anecdotally, I know that there's a number of city workers that have had this infection. Doesn't surprise me. A lot of everybody's had this infection. So we are seeing an increase. I think it's probably just in parallel to the rest of the city.
Thank you. Tumar and Mayor, can you speak to the gun violence prevention program grants that are ending or that the deadline is coming up, and also speak to some of the initiatives that have been successful?
More, please.
Well, I think as it relates to the grants, Martin, that application process is ongoing and open. So we're still encouraging people to sort of apply. Hopefully we're able to invest about $500,000 to community and grassroots groups, anywhere between the amount of $500,000 and $20,000 per group. Certainly this is our 3rd round of that. So we've seen some success with organizations sort of applying for these grants and doing good work with these grants. Certainly it's been some impact due to COVID and the way folks are able to gather. So some programs have to sort of pause their programming opportunities or have to, talk about moving their opportunities online. I know many of the programs that sort of work with the Urban Affairs Coalition, who manages the grants for us, with restarting their programs. So we're continuing on that phase. And just to echo what the mayor said, the real, folks criticize us for talking about the gun issue, but it's real. And I don't know how you talk about stopping violence without addressing the gun issue, but we're still doing other things, right? We're still doing a group violence intervention piece. We're still doing a community crisis intervention program that's been, in and out in these streets, going into communities before and after shootings. We're still doing a rapid response team. We're trying to get some trauma services and trauma care out to these communities that's plagued with violence. We're still doing all we can. But for folks to think that we should just ignore guns, it's idiotic. It's an issue, right? It's an issue that 12-year-old kids could get a gun easier than they could go to the corner store and try to get something that's, that you have to be 18 to get. It's just a reality. It's reality what we're dealing with. So we're going to continue to work. We have a bunch more work to do. No one is saying we have the solution. No one is saying we know it all. We're saying we're going to continue to work and evolve and sort of change our tactics. And we're going to continue to get community folks on board with us to do this work and help us with this work. Because some of these folks know their communities much better than us. They know what these communities need much better than us. We need them to be partners with us in this work.
Thank you.
Thanks, Martin. Right now, the only person I have left is Sean Walsh at the Inquirer with another question. So we'll do a last call if anybody has final questions to get in with the 3 minutes we have left. Sean, you can go ahead and unmute for this question.
Thanks. Just a follow-up for Dr. Farley. Could you elaborate on why it is you think, or why we're guessing that cases have fallen, it looks like, and positivity rates have fallen in the last couple of weeks?
Yeah, it's a good question. It's hard to really connect specific actions with change. I can tell you it looks like that we are seeing some decreases in other parts of the country. And we certainly have all been talking about this for the past few weeks of this increases. And it may be that finally all that talking has gotten everybody recognize that, yes, we are in a new wave and the population in general is following our safety precautions. That's just a guess.